Both an MVA and an assault can present with a pain chief complaint. Using our mnemonic old carts as our guide, we'll note the onset, or when did the pain start, the location of the pain. For the duration, we'd like to know if the pain has been constant since the accident, or is it more intermittent. If that's the case, we'd like to know how long does an episode of pain last, and how many episodes have you had since your accident. Next, we can note the progression. Does the pain appear to be occurring more frequently or more severely? Or if there has been no progression, we'll also be sure to state that in our patient note to show that we asked. To help characterize the pain, we like some descriptors. Is it sharp or dull, among others? And we can use this time to use our technique of pre, present, and post, as we'll see below. Aggravating and alleviating factors, radiation, treatments tried, and severity on a scale of 1 to 10. And again, if there are no aggravating and alleviating factors or radiation, we'll also be sure to state that in our patient note to show that we asked. On the pre-column, for an MVA, we'd like to know about the crash details, including the speed and what they impacted. For an assault, we'd like to know the relationship or assailant details. Presently, for an MVA, we'd like to know if there was a loss of consciousness, and if so, how long were you down for, including if there was any confusion afterwards. And for an assault, if there was sexual, oral, or vaginal penetration. And post, for an MVA, if they were an alcoholic or drinking, we'd like to know if they would consider an alcoholic program, and for an assault, if they have future plans. And very high yield for any case of assault or domestic violence, as we see below on the bottom, to help reassure our patient and state, I am very sorry for what you had to endure. This is not your fault. As a matter of fact, you showed great strength. I am concerned you may be a victim of domestic violence. Have you considered staying with family? The hospital or social worker has connections with homes. I'm always here for you, and if you want to discuss further, I'll be here. I think a change in environment will help you. It's very high yield to state this for any case of domestic violence. For all cases, we'll order a pelvic exam, CBC, serum electrolytes, and an X-ray skeletal survey. In a rib or extremity fracture, we'll see chest or extremity pain, dyspnea, and it can be aggravated by movement or deep breaths, and we'll add to our workup pulse oximetry and a fast exam. Both a pneumo or hemothorax can present with chest pain, dyspnea, and can be aggravated by movement or deep breaths. In domestic violence, we'll see chest or extremity pain, and there can be the physical or sexual assault, and we'll add to our workup a urine HCG, a nucleic acid amplification test for gonorrhea and chlamydia, HIV antibody and RPR for syphilis, wet mount and KOH prep, and cervical cultures. In a pregnancy, we'll see a sexual assault with the last menstrual period of typically a few weeks ago. We can have weight gain, and if we have any nausea and vomiting, we'll use our mnemonic of A, B, and C to note the amount, blood, and if there was any color of the vomitus for our patient note. And finally, in a sexually transmitted disease, we'll have the sexual assault. We could also have a vaginal discharge, and we'll use A, B, and C and vaginal pruritus.
Exam with a hand sanitizer, and we want to ask our SP if we have permission to examine you. Okay, we'll start with the hint exam. So we'll comment that there's no morsocephalic atraumatic. We don't see any lesions. We'll move on to the oral pharynx. So we'll use a tongue depressor here. The key thing to do is you don't want to add too much pressure for the SP. So just very lightly, you can press down and ask them to please stick out your tongue. Okay, and we'll comment that we don't see any lesions, any oral pharynx exudates. We could discard this. Transition to the cranial nerve exam. For cranial nerves, 1, we don't really assess cranial nerves, so we could kind of use that as a hint or as a placeholder to test their alertness and their awareness. So we could ask them, what is their name?
Kalichi.
And where are we right now?
The clinic.
Okay, good. And what time of day is it right now?
Afternoon.
Good. So now we could verbalize that they were alert and oriented times 3. Okay, now we could transition to the rest of the cranial nerve. So for cranial nerve 2, ask them to look straight ahead, and we're just going to check their pupillary constrict the response, and then we're going to do the same thing on the other side. We're going to do the same thing here, and then we're going to do it on the other side. Good. Now we could verbalize that they were pearl, if pupils were equal and reactive. We're going to transition to cranial nerve 3, 4, and 6. So please, you'll instruct them to please follow your fingers with their eyes, keeping their head straight, and you can see that he's able to follow. Okay. Trigeminal nerve, cranial nerve 5, and we're going to assess this with sensation. So please close your eyes and let me know if this is equal.
Mm-hmm. Mm-hmm. Mm-hmm.
Okay, good. So for cranial nerve 7, we're going to go ahead and ask him to please smile, puff out your cheeks, Okay, don't let me pop them. Close your eyes real tight, don't let me open. Cranial nerve 8. And we'll ask him to please close your eyes and let us know what side you hear this.
Left.
Okay, you hear this louder on your left?
Yeah.
Okay, good. So that would be a concern now if he has hearing loss on his right hand side. So continue with cranial nerves 9 and 10. So you could ask him to say, ah, please. And we would try to stick out your tongue, and we would visualize that we could see a non-deviated uvula. And while he's out here, we could also ask him to move his tongue left to right, and we could say that his hypoglossal nerve, cranial nerve 12, is intact. And now we will finish up with the cranial nerve 11. So please shrug your shoulders. Okay, so they're equal. And look that way and resist me. Okay, and look this way and resist my movement. Good. And now we're going to continue with MRCP. So for motor strength, please make a muscle for me. Okay, and resist me. So 5 out of 5, forward flexion, and extend 5 out of 5 on extension. Great. Now we're going to do sensation to light touch. So please close your eyes and let me know if you feel this equally on both sides.
Yes, I do.
Okay. Now we're going to do a pinprick. So please let me know if you feel this. Your left.
Oh, yeah, I feel
Okay. Now we're going to do the same thing on your right. We're going to do our reflex. So a biceps reflex. Place our thumb on the biceps tendon and instruct to just relax, please. Okay. You should get a 2+ response. We'll do the same thing on the other arm, and then we could verbalize we have a 2+ response bilaterally. And now we're going to assess the pulses. So we'll get a radial pulse, and we'll check on the other arm as well, and then we could verbalize that we have a 2+ radial pulse bilaterally. For motor strength on the lower extremities, could you please kick out? Okay, good. So that's 5 out of 5. Now could you please kick in? Good, 5 out of 5. Now we'll go into sensation. So please close your eyes and let me know if you feel this equally on both sides.
Yes, I do.
Okay, great. And now we're going to go into pinprick. So this is a pinprick. I'm going to start on your left side, and please let me know if you feel this all the way down.
Yes, I feel it.
Okay. And now I'm going to go onto your right side, so please let me know if you feel this.
Yes, I do.
For his patella as well, I want to ask him to relax and assess his patellar reflex. Okay, good. And now tap on his Achilles tendon. So we'd start right here, and we would get a normal reflex. We could also test while we're down here a Babinski. So we could start on the bottom of the sole and go into the big toe. And note, if he had a positive Babinski, his toes would curl up. For the pulse, we're going to go behind the medial malleoli, and we'll feel for the pulse, 2+ pulse. And then we could do the same thing on the left extremity and verbalize we have a 2+ bilaterally. Okay, now that we finished with the lower extremity, we'll go ahead and hand sanitize again. For the palm exam, the best way to do this is to drop down the gown halfway and ask the patient to please sit across your arms here, and this will hold the gown and keep them protected. So the first thing we want to do is verbalize that there's no visible lesions to the anterior chest, to the posterior chest. Next, we'll palpate. So we'll palpate his chest and just ask him if you have any tenderness there or pain. Tenderness or pain. Do the same thing on the back. Okay, and now that we've done that, we could go ahead and we could percuss. So we're going to go left to right, 3 spots. Okay, now we're going to go ahead and listen to his lung fields. We'll use the bell of the stethoscope for his above the clavicle, so we'll instruct you on instruct him every time you feel the stethoscope. Please take a breath in and out. Okay, that was a good equal breath. Now on the other side, so please breathe in and out. And you'll notice here that this time you don't notice a breath coming in and out of him. Instead, you'll notice arm shrug. So please do that again. You can see it again over there. So as we move on to the diaphragm now for his lower lung fields, please. Okay. And again, we don't hear a breath, and instead we see the arm shrug. I'll go ahead and do that for the last lung field, please. Okay, good. So that was a good breath. And we see the same thing as well. And now on the posterior side, we'll do the same thing. We'll listen in 3 spots, comparing left to right. So please, you see the arm move up and down again, and we don't hear a breath. On the right side, we hear a breath. The left, we see the arm move. Okay. So now that we completed the auscultation part, and we can make a comment that we heard clear breath sounds on the right, but on the left, we didn't hear the breath sounds. We want to use economy of movement to make use of the time and listen to his heart sounds. So the mnemonic we're going to use is the Parmet M225A. So we'll start off with his aortic in the second intercostal space on the right. Go ahead to this pulmonic, tricuspid, and mitral. And if this was a female patient, you could ask them to please lift up your left breast. Make a comment that we heard an audible S1, S2, no audible S3s or S4s or murmurs, rubs, and gallops. Once we concluded the cardio and pulm exam, we could cover him up again. Now we can instruct him. I'm going to now lie you down to do the abdominal exam. Is that all right? Okay, so we want to help them down. And you don't want to forget to extend the legs for the leg rest. Now you could rest your legs. For the abdominal exam, they'll have a gown here, and you want to move it up all the way to their pelvis, and then you want to ask permission to take it up. We want to do the same step again. We want to first verbalize that we see no visible lesions, and after we completed that, we're going to now listen. We're going to auscultate. First, ask if he has any pain anywhere.
Yeah, just right here.
A little pain on the upper right side. Okay, so now we're going to go ahead and start on the opposite side on the lower left. So, okay. Go to the right. Okay, we could verbalize that there were normal active bowel sounds. Once we completed the bowel sounds, we can now go ahead and percuss. So he had pain on the upper right. We'll start on the lower left. Okay, and we could comment again that there were normal resonance to percussion. Now we're going to go ahead and palpate. So the tip for this is for superficial first. We're just going to use one hand, and we're going to start on the lower left. And you want to make good eye contact to see if he winces at all, or let him know if you have any pain to please let me know. We'll do it in the 3 quadrants on the bottom, 3 middle quadrants, and 3 upper quadrants. Okay, and then we could have good confirmation that he was in pain. And for deep, we just want to place our second hand on top and do it again. Okay, so we could.
Ouch.
He had a little pain there on deep. Okay, and he had pain on the deep palpation. Once we completed deep palpation, we want to go ahead and check for hepatomegaly. So the best way to do this is to place your hand under the border of his liver. You want to instruct the patient to please breathe in. And then as he breathes out, you can breathe out now. You want to go all the way up into the lower rib cage, and as long as you don't feel the liver extending below, you can verbalize that there was no hepatomegaly. And you can do the same thing for the spleen. So again, please breathe in, and now please breathe out. Okay, and you could feel the lower left rib, and there was no spleen coming down. That concludes the abdominal exam, so you could help cover them again, and then sit them up, because it helps sit you up. Okay, and then you just want to ask them if they have any questions for you.
Yeah, no.